South Milwaukee COVID-19 staff training health protocols. Purpose: inform staff of protocols that are in place for return to school, explain how we track COVID-19 in school, describe the educator expectation in contact tracing, answer any questions that you may have. Why masks? A person can spread infectious respiratory droplets for 48 hours before they are showing symptoms of COVID-19. Masks hold on to a large portion of your own respiratory droplets, protecting the people around you from those possibly infectious droplets. Wearing a mask will not stop you from being quarantined if you are within 6 feet of a person for 15 minutes or greater, but it will decrease the chance of you becoming ill with COVID-19. New gaiters. We are implementing a new policy regarding gaiters. They will need to be at least 2 layers of material. 1 layer of material will not be sufficient. We also will not allow fleece gaiters, which is an existing policy. Staff are on the honor system. For students, we will inform families prior to return to hybrid. We anticipate that there may be a need to switch out a gaiter for a mask if it seems thin. You can send students to the health room for this. Why hand hygiene? Viruses and bacteria on our skin alone are not harmful. Viruses and bacteria entering our bodies through our mucous membranes, nose, eyes, and mouth. If you pick up infectious droplets on your desk, handrail, doorknob, or light switch to keep yourself from becoming ill, practice hand hygiene frequently. Health Department. Amy Whitinger, me, is in daily communication with the public health nurses at the South Milwaukee Health Department. I have weekly meetings with the South Milwaukee Health Department nurse supervisor, and I receive weekly updates from Jackie Ovey, the South Milwaukee Health Administrator. Jeff Weiss and or Jen Seeloff have weekly meetings with area health department administrators and superintendents, as well as have frequent communication with Jackie Ovey and receive the weekly updates as mentioned above. Due to staffing, the health department are unable to do contact tracing for school contacts, but they will be handling all social and familial contacts. The local health departments notify me when they know of a South Milwaukee student that is either positive or quarantined due to contact with a positive case. We also find out this information from families and sometimes from staff. Remember to use the student concern form to report if you believe there is something we should look into. Please do not fill out the form if you know the information was provided to the school secretary already. Attendance. Parents should be screening their students daily for symptoms. When parents call students in for the day due to illness, our amazing secretaries put the student names into a spreadsheet that I review. Our contact tracer and I follow up on students who are having symptoms that could be COVID-19. If their symptoms necessitate COVID-19 protocol, I send out a detailed letter via email with guidance and dates they may return to school and notify the South Milwaukee Health Department. The student will then be isolated or quarantined based on the specifics of their situation. If a student is ill and in COVID-19 protocol, they may come out of quarantine early if they have an alternate diagnosis from their doctor or a negative COVID-19 test. 6 students in class. If a student is ill in class, please send them to the secondary health room with all of their belongings in the event they need to go home. Students that have documented chronic medical conditions that explain their symptoms will not be sent home or put into COVID-19 protocol unless they are unable to control their secretions or their symptoms are increased from what they normally experience. Contact tracing and quarantine. The district contact tracer and I do contact tracing for the students in the district. I have the authority to quarantine contacts in these settings. I do not have the authority to quarantine for contacts outside of school-sponsored activities. The health department doing the disease investigation is responsible for this. Staff expectation for contact tracing. Seating charts should be turned into the office prior to students being in the building. Please remember that a close contact is anyone that has been within 6 feet of another person for 15 minutes or greater cumulatively, or has had direct contact with their secretions. Please keep our students' privacy in mind when talking to peers and families about COVID-19. Student quarantine. If a student is a close contact of a person who is positive, they will need to quarantine for 14 days, even if they have a negative COVID-19 test. They may return to school on day 15 after exposure if they are well. If they become ill during their quarantine, they will start a 10-day isolation from the start of their symptoms. To be clear, the first day they have symptoms is considered day 0. They can attend virtual instruction if they are well enough. Staff notification of positive cases. I cannot disclose a student diagnosis without permission from the student's parent. I will not be notifying staff of who is positive. You will be notified if you are a close contact to a positive person, including students. A detailed email will inform you of your next steps. Otherwise, there will be an email with general information. A general example is a person in your class or building has tested positive for COVID-19. Parent notification of positive cases. Parents receive a detailed letter via email that gives guidance and specific dates related to isolation or quarantine. Close contacts will be notified. I will not identify the positive person. A letter will be sent to classrooms if there is a positive case. It will not identify the positive person. Questions. Please email me, Amy Whitinger, at awhitinger@sdsm.k12.wi.us if you have any general questions about student COVID concerns. If you have specific COVID concerns related to a student, please complete the student COVID concern spreadsheet. I look at this several times per day.
Hi, this is Jen Seeloff, Director of Personnel Administrative and Legal Services, and I'm going to go over some of the staff COVID procedures that we have been following. If it is determined that you have been a close contact to a student or staff member that tested positive or is a probable case, you will be notified by email and or by phone by me or your building principal or supervising administrator. Please know that we consider contact tracing an extremely important job, and you will be notified personally just as soon as we can. If you find out that you were a close contact to someone outside of school, please put that in the daily survey. If you find that out while you were in the building, please isolate yourself right away and leave the building as soon as you can. Please continue to fill out the symptom tracker honestly each day. We do change the survey every so often. This is generally due to a new situation that arises that the survey did not do a good job of reporting. And speaking of changes, there will be a slight change for you on Monday. There'll be a new reason why you're not attending, and we're changing the order of the no's, I won't be in the school building today, to make working virtual the last one. This will match the order of the none of the above questions for all of the symptoms that you have to make it easier to choose if everything is normal, whatever that may be this year. We are trying to make the survey as easy to understand as possible, which is why this new change is being made. But please send me an email if you're in a situation that you don't think is covered or if something new comes up after you completed it for the day. I do get several of these types of emails each week, and I'm happy to provide feedback on a particular situation. There are several survey options that will result in you receiving the Not Certified X at the end of the survey. These include, I'm using sick leave for myself that is not due to being told to stay home due to COVID. So this would be something like a doctor's appointment, if you're feeling ill, you broke a bone, something like that. And note, this will be one of the new wording options that you'll see on Monday. I'm staying home due to isolation or quarantine. You'll use this option if the district or health department or another workplace has told you that you should be in isolation or quarantine due to COVID situations. I tested positive. Use this option only once, then switch to the I'm staying home due to isolation option. Another one that will result in an X will be I was a close contact to someone who tested positive or is a probable case. Again, use this one just once, then switch to the I'm staying home due to isolation option. Remember, a probable case is someone who was a close contact to a person who tested positive and has now developed COVID symptoms. Another option that will get you the red X for the day is I went for a test and I don't have the results yet. If you go to a test for any reason, please let us know. If you were a close contact, please use that option and not the I went to a test one, because the close option or close contact option gets us more information and can get you the length of your quarantine faster. Your test results then may end up changing your dates. Or not an option for you to choose, but if you select certain symptoms, you will get the red X. If you do receive that X, please stay home. Many of you and have positions that you can work from home. It just means you can't come into the building on that day. If you get the red X because you clicked the wrong button, and many of us have done it, it is early in the morning when you're filling out the survey, you can come to work. Just email me and your principal and tell us that you don't have any symptoms, you didn't go for a test, and you're not a close contact. You don't need to wait for a response when you hit the wrong button, as long as those things are all true. However, if you get the red X for something else, please do not attend on that day. If you fill out the survey, there's a question at the end about, do you think these symptoms are due to something else, such as allergies? You can fill that out. You can also email me and your building principal and let us know about the situation. But please wait until you get a response before you come back in. Again, just please let me know if you have something going on that doesn't seem to fit in the options on the survey. So we use the terms quarantine and isolation. A quarantine is 14 days and it happens when you have a close contact with a person who tested positive or is a probable case. This is counted as the last day of contact is day 0 and you get to return on day 15. I'll typically put in the first work day after day 15 is the time that you can return to work or to the building. So if day 15 is a Sunday, I'll put in Monday as your day that you can return to the buildings. Remember that a quarantine can be extended beyond the 14 days if you start getting symptoms. So for example, if you're in a quarantine and on day 10, you lose your your sense of taste and smell, then you'll move into isolation for 10 days. This is because you're now shedding the virus and you can be contagious for 10 days since the start of your symptoms. That's why it's so important for you to fill out the daily symptom tracker each morning, even when you're in quarantine. Also, please remember that you cannot end quarantine early with a negative test. This is because even though you may test negative on day 5 of your quarantine, you could still test positive on days 6 through 14. Isolation is 10 days long, and this occurs when you test positive or you have symptoms. Similar to quarantine, day 0 is the day of your test or the day of your first symptoms. You can leave isolation early only if you are not a close contact to a person who tested positive or is a probable case, and you receive a negative test that is a molecular test, and you are fever-free for 24 hours without the use of medication, and your loss of taste or smell is not part of your symptoms because those are almost always COVID related. So that's why it's really important when you get your negative test that you send it to me and we talk through these things via email usually to make sure that it is safe for you to return. It's also important to remember that if a person in your household tests positive, your time could be extended if you can't completely isolate from that person, which means a separate sleeping, eating, and living area, as well as a separate bathroom. So if you need to be out on quarantine or isolation, I will send you a detailed email with all the dates involved, the expectations, subbing if we're back in person, contact tracing, and any other detail that you may need to know. There are several scenarios that people typically have questions about because they're not always cut and dry. And all of these scenarios I'm going to go through have happened to multiple people, although there might be a slightly different relationship in each one. So the first one is, my grown son came over last night and today he found out that his roommate tested positive. How does this impact me? So without symptoms for your son, You do not need to do anything. However, if he gets symptoms, he becomes a probable case because he had a close contact and developed symptoms. And then you'll need to report the contact and quarantine for 14 days. The same is true as if he decides to get tested and test positive. Second, my middle school daughter was a close contact at school. She doesn't have symptoms, but we're going to get her tested anyway to check. So again, without symptoms, your daughter is not a probable case and you are not required to stay home. If she gets symptoms or tests positive, then you will need to report the contact and quarantine. If you decide to get the test on the same day, we're asking you to stay home until you receive the results. Any type of negative test will work here since you don't have symptoms. It's only when you have symptoms that we require the molecular test for the negative result. The third situation is that I just found out that my wife tested positive. You will be out for at least 14 days since your last contact with your wife. But if you can't completely isolate yourself, you will be out for the 10 days of her isolation, then a quarantine of 14 days for you. This can only be shortened by completely isolating yourself from your wife, which again is a separate living, eating, and sleeping area as well as a separate restroom. Or if you receive a positive test, you will be isolated for 10 days since the date of your test. The fourth situation is that I'm going for a COVID test because I think I was exposed. No one has told me that I was a close contact, but I kind of think I was. Again, please stay home until you receive the test results, and if it's positive, then we will go from there. If it's negative, again, you'll be able to return once we get a chance to review it. If you do receive a negative test result or a positive result, whichever it may be, please send it to me. Please wait for a response before you return to work. I do have a chart from the health department that I review to make sure it's the correct type of test for a negative result. If you need a leave or think you may need leave due to a COVID situation, please email me with the details about why the leave is needed. Regular FMLA requests should follow our normal procedures of completing the form that is on the HR section of the website. The COVID leaves are fact specific, depending on the age of the students, what their school schedule may be, if the person you're caring for is not a student, if they are unable to care for themselves or if they can care for themselves, things of that nature. So, for instance, if your otherwise healthy 17-year-old son needs to isolate and he does not have symptoms, you won't be able to take a leave because he is able to care for himself, other than probably bringing him food on a regular basis. However, if it is your 4-year-old son and he does have symptoms, a leave would be granted because he is not able to care for himself. If you have any questions, please email me. I'm happy to help in any way that I can. Next, Dr. Weiss is going to discuss moving between learning models.
Hi, this is Jeff Weiss, Superintendent for the School District of South Milwaukee. I'd like to take this opportunity to address a couple of topics regarding our learning mode. First question that I would like to address during our time together this afternoon or this morning is when we will return to a hybrid model. We will continue to look at our community data, such as our burden rate and our positivity rate, to make that determination. When our burden rate is under 350, and that burden rate is the number of cases per 100,000 people for the city of Milwaukee, when we're under that, we will give a week's notice that we will then be transitioning to the hybrid model. Based on this process, the earliest that we would return to hybrid now would be November 16th. We are continuing to monitor our burden rate and we get weekly updates every Friday afternoon. And I'll be communicating this out. It'll be posted on our learning model dashboard that's on the district website as well. So as we look at what metrics we'll use to move to a less restrictive learning model, we're using community metrics to make that decision, whether we're moving from virtual to hybrid or hybrid to more in-person days in a building. This is what we will be using. And that again is the combination of the burden rate and the positivity rate for the city of South Milwaukee and for Milwaukee County. This chart is a familiar one. It should be a familiar one. It's the one that we've been using since July. It was modified in September, and it remains pretty constant. The only new addition to the burden rate is a new category. It's not a new category that the state could be adding. It's not a new category that we'll be using. The dark purple one, the 350 plus, is critical, and that's still our cutoff. The state may be adding, and I think that's fuchsia that we put in the screen there. The state may be adding a new state threshold, and that's just based on some of the exponential growth of the virus in different parts of the state is requiring a new category. So that is the burn rates computed by looking at a 14-day rolling average, and it's based on 100,000 residents. And this allows for communities to have a comparison to see the rate of spread in different areas and regions of the state and county. We'll also be looking at the percent of positive tests in Milwaukee County, as well as the city of South Milwaukee. And again, that's computed on a 2-week rolling average. Under 10%, ideally will be under 5%, but in between 5 and 10% is considered to be acceptable. Over 10 is high. In looking at moving to a more restrictive learning model, there are some internal metrics that we will be using as our primary source of information. And the reason for this, including our internal metrics, is that they are much more specific to our school community than the city metrics or the Milwaukee County metrics. There's approximately 1 million people in Milwaukee County, approximately 20,000 people in the city of South Milwaukee, and we have about 3,000 or so students and staff that would comprise the district. We will begin using the internal data after we get 2 weeks after we've been in school for 3 weeks. At that point, we'll be using our internal data as our primary decision-making data to determine whether we would move from hybrid back to virtual, in-person back to hybrid, and we'd be using that internal data as our primary source. We would definitely still take a look at our external data, and that would weigh in to our decision-making process as well. Just to go back to October, earlier this month, I believe it was October 16th, that afternoon when we made the decision to move to a more restrictive learning environment, we moved from hybrid back to virtual. We had only 1 week's worth of internal data at that time. And in that internal data, I'll go through in a moment here what some of the metrics are that we look at, but with just 1 week's worth of data and a 265 point jump in our burden rate for the city of South Milwaukee, we used that burden rate in our community data to pivot back to virtual learning. So in taking a look at what are some of these internal metrics after we've been in school and we've been able to build up a greater sample size, greater number of data points to look at. One of the things that we're going to be looking at is students' attendance related to COVID, and this includes the number of students who are quarantined or in isolation. Students are quarantined for close contact, and they're isolated for positive tests if they have COVID-19. We're also looking at staff attendance in the same manner, if the number of staff quarantined or isolated. And to take a look at our metrics for this, if we are under 5% absences due to COVID, that's considered to be optimal, and that's including both quarantined and isolated. Between 5 and 10 is acceptable. Over 10 is, then we get into the high and critical ranks for the number of staff or students that would be out. And looking at closely related to staff attendance is substitute availability. The number of substitutes would be available to cover classes. Under an optimal situation, we would be using teachers on call in our building substitutes to cover our absences. In the acceptable mode, we are looking at having other South Milwaukee internal staff available to cover. And just as a note, those are pretty common practices in non-pandemic years. When we get into high and critical rates, that's when we have limited South Milwaukee staff available to make coverage, and critical, which could cause a school or potentially the district to close, would be when we do not have enough substitutes to fill classroom teacher absences. Additional internal metrics, we are looking at our safety precautionary measures, and this includes our supply of sanitizer, disposable masks, our physical barriers, and our ability to conduct daily disinfecting. Optimal conditions, we would have no concerns. Acceptable would be some supply chain concerns. But we would still have the product on hand, the sanitizers, the masks, the barriers, and ability to conduct disinfecting. If we had supply chain issues, we would be in the yellow area. It would be critical, and it would cause either an individual building or the district to close if we did not have enough hand sanitizer, masks, barriers, or we were unable to conduct daily disinfecting. That would be considered critical and cause for a closure. The next 3 items are more observational, and I would categorize them as more a bit of on the qualitative side than actually on the quantitative side. For these factors, we're looking at a weekly sampling in each one of these categories. For example, with mask wearing, if we have students or anybody in the building who are continually wearing their masks, then it's considered to be an optimal situation. If there is redirection required, it's acceptable. It's something we obviously want to be in the optimal range, but redirections would be considered to be acceptable if a couple are needed. We would be in the high area. It would be an area of high concern if there were groups of students or groups of individuals not wearing their masks. That would be an area of high concern. Similarly, the same process would be used for cohorting and looking at our ability to cohort and physically distance. It would be optimal if we are seeing individuals consistent with our plan to space themselves out in lunchrooms, in classrooms, in the hallways. If there was redirection required, again, that would be considered to be acceptable, but something we'd want to improve upon. And it would be an area of high concern if the practices were very inconsistent with the plan. Internal contact tracing. The district does have internal contact tracers on staff. And if we are able to notify all of the people who have been in close contact, and close contact is defined as within 6 feet for a cumulative of 15 minutes over the course of a day. If we're able to notify all of those individuals within 24 hours, that's optimal. It's acceptable if we're able to get to at least half of those cases within 24 hours, a range being from 50% to 99%. And it's an area of high concern if we aren't able to notify individuals of close contact, at least half of the cases within those 24 hours. And I'll leave you with an ask. At work, we're confident that our staff members will follow our guidelines to stay home when necessary, wear a mask while you're here, physically distance, and wash your hands regularly. These mitigation strategies work, and we are asking, redoubling our efforts in these areas to mitigate the spread of the virus as much as we can. Please also do the same while you're out in the community. Limit your attendance at gatherings. Wear a mask when you're with others who aren't from your household, and physically distance when you can. We're coming upon the holiday season. The weather's turning colder. And not only do I have concerns, but I've heard medical professionals offer concern as well that as the weather turns colder, and this may be some of the reason behind, and from what I understand, it is the reason behind our surge in cases here in the fall. What we do in the community definitely impacts what we can do here at the school. So I ask you to do all you can to help get us back in person with our students. Thank you so much, and have a great day.